side will be your central sulcus and your may isang hawak and your lateral fissure, because from there you could work with the upwards and downwards. Kaya mo ng gloves sa
Dok, gusto niyo po to? Meron pa doon sa loob? Hanggang loob yata.
Yun?
Ano yung bulaklak yan? Kailan mo ka eh? Ay,
So,
yun nagkulay.
so the first you have to establish would be, obviously, si lateral fissure. It's gonna be this thing here, right? And then so, the other thing you'd be looking for would be your central sulcus. Okay. Now, by definition, your central sulcus is the longest continuous sulcus, horizontal sulcus on the lateral surface. So, one of the things that you'd have to try to establish na lang would be, is it this or is it this? Diba? So your other clue there would be, when you look at the medial structure, so let me just go ahead there. You will see you have here the marginal sulcus or the marginal branch of the cingulate. Pero ng pointer.
You have a point.
Okay lang?
I'll just kill you.
Sige. So, this is your cingulate sulcus. Okay? And you will notice that your cingulate sulcus will go up. That becomes now what is the marginal sulcus, or it is actually known in some books as the marginal branch of the cingulate sulcus. It's clearly attached to your cingulate sulcus. Once you've established that you have here your marginal sulcus, then you know this particular sulcus here becomes your central sulcus. Okay, so now everything anterior to your central sulcus becomes your frontal lobe. Everything inferior to your lateral sulcus becomes your temporal lobe. Since it's quite easy at that point in time. So now, if you have here your central sulcus, then you have a bump, gyrus. So what do you call the bump? Immediately in front of your central sulcus.
Precentral.
Okay, that's your precentral gyrus or Brodmann area 4. That's your primary motor cortex. So now, if this is your precentral gyrus, so that's why I'd rather you first talk about your basic landmarks. So I'll walk from you there. So if this is your precentral gyrus, then you now have a depression immediately in front of your precentral gyrus. Okay, your precentral sulcus. Okay, now, immediately anterior to your precentral sulcus as far as a functional classification is concerned. So there, it's not a gyrus per se. Will already be your Brodmann area 6. Okay, Brodmann area 6 will be your supplemental motor cortex. Okay, of interest, only 1/3 of your corticospinal fibers will be coming from there. So, Brodmann area 6 are your supplemental motor cortex. However, it does not go all the way in front of your precentral gyrus. You will note that you will have now horizontal sulci. You have this horizontal sulcus and you have this horizontal sulcus. So this is your superior frontal sulcus, inferior frontal sulcus.
Hindi po ba baliktad? Ay, ayaw nga balik niya. Rito pala yung baba. Yeah.
Okay. So which will divide the rest of your frontal lobe into 3 gyri. Your superior, your middle, and inferior frontal gyri. You will notice that theoretically, of the 3 gyri, the widest would be your middle frontal gyrus. You could have here a sulcus, which I'm sure Dr. Vibar did not mention. Because it has no name. No, maybe you read Carpenter, you'll see that. Okay, there. Okay, so.
So this is superior and that's inferior?
Yes. And it doesn't have to be, by definition, it doesn't have to be all the way through. Eh. So what you see on the board is actually just diagrammatic representations. So what you have to see is that you would have a significant depression, upper portion, a significant depression, lower portion, which divides your frontal lobe into 3 gyri there. Okay. So now, going back, this is the precentral gyrus. So Brodmann area 4, and I said immediately anterior to Brodmann area 4 becomes Brodmann area 6. So this is Brodmann area 6, this also is Brodmann area 6. However, when you reach your inferior frontal gyrus, you don't anymore call it Brodmann area 6. Okay, now, in your inferior frontal gyrus, you will have there 3 parts. Okay, you will have your triangular part, your orbital part, and your opercular part. The operculum is actually a junction of 3 anatomic lobes leading to your insula. That's why they say, diba, if you were to separate your temporal and your temporal from your frontal lobes at the level of your lateral fissure, you should be able to appreciate your insula or your island of Ryle. Okay, now that said, rather than do it this way, since for your practical, me personally, it would be easier when you look at it na lang at the level for your lab for the basal ganglia. There you would have a very clear view of your insula there. But anyway, your operculum is the junction. Okay, so it's like if you remember the fish opercula, diba? So there. So now, for me, when you do those 3 parts, for me the most obvious thing to look for will be the triangular part. Okay, so here you get to appreciate, here you get to appreciate, although sira, sulcus going up. You also have a sulcus going up here. This now is your anterior limb of your lateral fissure, and this is the ascending limb of your lateral fissure. So the anterior and ascending limbs of your lateral fissure will now form both the anterior and posterior boundaries of what, if you were to make an imaginary line, diba, from this. If you were to make an imaginary line on top of it, how would it look like? It would look like a triangle. So this is your triangular part. That is Brodmann area 45. Okay. Now, immediately posterior to your pars triangularis becomes now your pars opercularis. This is Brodmann area 44. Brodmann area 44-45 will give rise to your Broca's area, your motor speech area. Okay, now, most books would actually just focus more on the 44. I think your manual still says 44-45 as your Broca's area. Now, that said, let's go back. 6-6-44. Why is that? Remember, when you talk about your precentral gyrus, you have here your motor homunculus. Diba? You have a point-by-point representation of the body in your precentral gyrus. Okay, and if you were to read Goldberg, he describes as HAL. Okay, head, arms, leg, and he says that as far as the cerebrum is concerned, HAL is very lazy because he's lying down. So the head is here, your arms, your legs would be in this aspect here. Okay, so and you know that the supplemental motor cortex, what it does is that it will help modulate or modify the impulses coming from, kasi it's an association cortex. It will help modify or modulate the impulses coming from your Brodmann area 4. So here at the superior frontal gyrus, it will most likely help modulate the impulses for your arms. Here, it will help modulate the impulses probably for your eyes, and I will again expound on that later on. So this part, 44, will most likely help modulate the impulses for what? Your lips and your tongue. And that is what is motor speech. Okay, so there. So again, let's go back. This is your pars triangularis. Everything in front now becomes your orbital part or your pars orbitalis. You have a clear clue there. You should be able to appreciate a depression here. This is your orbital depression. Okay, so this is where you find your eyeball. Anyone here who was a psych major? Anyway, when I used to teach psychology, I enjoyed pointing this out because there was such a thing in the olden times. 1940s, 1930s, it was quite popular. They, for psychiatric patients, for patients who were hard to control, what they would